Welcome to this edition of On the Scene. I'm your host, Tim Kelly. On today's program, we're going to spend some time with the Western Tidewater Health District and get the latest information on the Zika virus. Then on the second half of the program, we're going to talk with Suffolk Mosquito Control and find out what you can do to help yourself, as well as your neighbors and everyone around you, be a little more mosquito prepared when it comes to the spring and summer, and also find out what the division's doing to help you as well. Stay tuned. Welcome back to On the Scene. Join us today. We have Dr. Nancy Welch, who of course is the acting director of the Western Tidewater Health District.
That's correct.
And we usually talk to you about a variety of different health topics, and today we're focusing on Zika.
Yes.
And certainly that's a name I think we've all heard to one time or another over maybe the last 6 to 7 months, maybe a little longer. And maybe we haven't heard so much about it recently, but it is sort of back in our focal point right now.
Absolutely.
And certainly with the onset of mosquito season and things kind of ramping up there, it definitely comes to our attention. So let's jump back in and kind of back up for a second and say, what is Zika? When we talk about the Zika virus, what are we talking about?
Well, Zika is the name of an infection caused by this Zika virus, and it's very similar to an infection. People may have heard the name chikungunya or dengue, and it's very similar. You get fever, you get malaise, tired muscles, you can get a rash, but the characteristic distinctive feature with the Zika is you also will get usually red eyes or conjunctivitis, and you don't get that with the other infections. But of even more concern than those types of symptoms, because frankly 80% of people will have no symptoms.
Correct.
So for every one who has symptoms, there are going to be 4 others who don't.
Got it.
But what's most of concern, and I know people are probably aware of this, is the impact on the baby. Because it has been confirmed now through some pretty intensive epidemiological investigations by the CDC that yes, it is associated with the microcephaly or the small brain in babies, and that can have immediate and long-term impact. And there also is some association with Guillain-Barré's, which is a neurological impairment as well.
Now, if you think you have the virus based on some of the symptoms you've laid out, and again, obviously the thing would be to go to a doctor and get checked out, correct? What is is there a treatment? Because I believe there's not a vaccine or something to prevent it, correct?
There is no vaccine, right, and there is no treatment per se.
Okay.
So, and it's really pretty mild. You're going to get over it.
Right, right.
It's the impact on the infant
right,
that is of most concern.
Yes.
But I consider the mosquito that transmits this, I've used this term a number of times, a rogue mosquito. It's not like the other mosquitoes.
Right.
It's a homebody. It stays around your backyard. It stays low to the ground. It flies during the daytime, and it only flies a couple blocks.
Right.
So it is very definitely a rogue mosquito, and although we do trapping and we do mosquitoes and we test the mosquitoes, even though we will get some of this, primarily albopictus is the one we're talking about in this part of the country, we may get that in some of the traps. It's not going to be a true reflection of what's present because this is in your backyard.
Right.
This is a real paradigm shift. This is a huge shift in our thinking process. We can't rely on the mosquito control process because the major focus is on what people do in their yard. And so we need to keep pounding this forward because that is a huge paradigm shift.
And when you talk about what people do in the yard, explain exactly what we're focusing on when you refer to that.
Sort of the catch term that
right,
people use is tip and toss.
Right, exactly, yes.
You know, you've probably heard that.
Yes, ma'am.
And that's because it only requires a teaspoon or so for this mosquito to be content and for the water. So it's not the ones that you see in the ditches or any of that.
Right.
This is the ones that you see like plates you put underneath plants in the backyard, or bird baths, things that you have in the backyard. So tip and toss is pretty much saying every week you want to tip that over and dry it.
Right.
Because it takes about 7 days actually for it to develop. So if you do it every week, then you're going to be protecting yourself. You're going to be preventing the maturity of any of these larvae. So you're not going to have the problem with the mosquitoes. But you need to check your yard, and you need to eliminate what we call container type water, because that's where they like to live.
And it's a very simple step. And I mean, but again, it's sort of evaluating your territory, your plot of land, if you will. And I know, our mosquito control division also provides the mosquito dunks, where if you have, now granted, what you're talking about, you're not going to put a mosquito dunk in a plate that's under a plant or things like that. You might in some standing water.
Because there are other mosquitoes that we also worry about. So we're talking about Zika, but where there are also other mosquitoes we worry about that transmit the triple E, the Eastern equine encephalitis, and the West Nile virus. So we don't mean to neglect that.
Correct.
Right.
But again, simple steps, like you said, tip and toss, it's just very, very easy to do. But again, I guess, like you said, because the type of mosquito that you were referring to, because its characteristics or behavior patterns are a little different, where I know we've talked in the past where it's been more the evening or the dusk hours where those mosquitoes are even early in the morning perhaps, where they're a little more active. It kind of throws off that curve when you're talking about that type, correct?
Yes, it's totally different. And that's why I say this is a real paradigm shift. So our goal is to have some communication to the public by any of the media available to continuously pound this forward and continuously let people know that really the burden is on the individual. I know we like to say, well, we have a mosquito control and we pay for mosquito control, and they're going to help us most with the mosquitoes with regards to West Nile virus and triple E. That's where their methodologies will be of most value. But for the Zika, it's going to be backyard, and especially where we're talking about young women who are pregnant or may become pregnant, because that is not the symptoms of the disease that are of concern. It's a transmission, and it, as you have mentioned earlier, to date we have no disease that has been transmitted within the United States.
That's correct.
It's come from outside, but we also are just beginning our mosquito season, and as I said, for every one who had symptoms, there were four who don't, but they still have the virus in their system. That mosquito can still bite them, transmit the disease. So we cannot assess sort of the prevalence based on either our trapping of the mosquitoes or the presence of disease. So it's a real shift here. So we have to just act preventively. Yes, we still want to use mosquito repellent. We still want to have long sleeves. Those are all things sort of after the fact. The mosquito's already there. So we're trying to focus on keeping the mosquitoes from being there.
You eliminate the source, then that kind of helps, really goes a long way to helping the situation. What has the medical community learned? Because again, I know the Zika situation, at least informationally that we started hearing about it, I believe was Africa was first and then South America?
Yes,
is that
Brazil,
correct?
A lot of publicity was related to Brazil because of the Olympics. Yeah.
But of course, what have we learned, or what was the medical community learned, I should say, about dealing with this once you have a situation where people are having the virus, and then of course then you have to deal with the transmission, as like you noted, to the infant.
This is a very dynamic process. I would tell you the first thing that we learned, a lot of the information that in terms of the association with the infant had not been intensely studied by epidemiologists. And that was the first, because we don't want to have anecdotal information making these very important decisions. So the Center for Disease Control dispatched a large number of epidemiologists who did a true, intense epidemiological on thousands of people and confirmed, yes, indeed, it is associated with the microcephaly, and there is a very strong potential association with the Guillain-Barré. It's essential first for us to know the facts. And that was the first step that we needed to do. And so that also gives us information about where we're targeting some of our focus. So a lot of information's been disseminated to physicians, especially OBGYN, trying to also disseminate information to women through daycare centers or social media so that they can be the ones to pay special attention, and to men, because it can be transmitted sexually for men who have been in some of these countries, and so protection is recommended for that. So we're making every effort to share the information. And I would tell you that weekly, we get new information and the information changes. I don't say that to discourage people, because I know people like to get the information, know it's going to stay the same forever, and they like that. But the flip side of science is that we're learning new things every day. That's a good thing. It's a good thing.
Yes, it is.
It just means we have to be resilient and sort of roll with it. And so we have received truly new criteria for testing. And we're just disseminating it now to physicians. It used to be that it was limited to people who came from the countries, and there were more limitations on it, but now it's pretty broad scoped. And the state of Virginia now has a way that we can test it ourselves. We used to have to send all of the tests to the Center for Disease Control, so it took a lot longer, but now we can send it to our own lab in the state, and there's a private lab that can do it. It would have to be paid for. If it has to be done through the state lab, it's free.
Yes.
So we're trying to disseminate that information to all of our medical community, but we're all having to adjust to the fact. In fact, tomorrow I have a conference call, so we have a weekly conference call
Correct.
to catch up. But we all have to adjust to that, because it really is in the best interest of everyone that we keep abreast of the latest information and the latest criteria so that we can offer intervention. Again, the important thing when you say about they're going to, because I say for everyone who has symptoms, 4 don't,
Yes.
we're not going to know all the people who have it,
Correct.
which means we're not going to know all the pregnant women who
Correct.
have it, which
Correct.
is where our target population is. So that's why we're trying to emphasize so much for the prevention and in their own yard, and to disseminate that information through OBGYN physicians so that their patients can focus on primary, that's called primary prevention, to prevent the exposure of the disease. Because once they're infected, yes, we can monitor, yes, you can do ultrasounds, you can do those evaluations, and we can be prepared.
Correct.
But there's not a way to stop it.
I understand.
At least not that we yet know.
Correct. And again, I guess as you said, as information continues to evolve and change over time, we learn more, we become more responsive. You talk about the testing now here in the state of Virginia versus having to go to the CDC.
Right.
So again, things are changing within our local resources and
Daily.
things, and like you said, getting that information out to the community. You know, we go back to the tip and toss, which you suggested, certainly when it comes to when you're out in the yard and doing that kind of a thing. And I guess just being aware of your surroundings and being aware of what you can do as an individual to help not only yourself, but potentially your neighbor or a relative or whatever.
Right, and we're in this together.
Correct.
Because Mosquito doesn't care if there's a fence between yards.
That's right.
They may only fly a couple blocks worth, but there are a lot of houses in between those couple blocks. So yeah, we're in this together.
Okay, good deal. Well, Dr. Welch, I appreciate you spending time with us today to talk about what the Zika virus and sort of the situation we find ourselves at this date and time. Of course, things will change, and we'll continue to monitor and hopefully have follow-ups as well.
Thank you so much for doing this.
Appreciate that. That will do it for this segment of On the Scene. We'll have more when we return. Welcome back to On the Scene, joined now by a familiar face here on our program, Charles Abadam, who's our mosquito control superintendent, I should say, for the City of Suffolk Public Works Department. And Charles, thank you for being with us once again.
No problem.
Now, when we see you, we talk usually about one particular topic, the M word, mosquitoes. And, you know, here we are, kind of late spring, getting closer and closer to the beginning of summer. The weather patterns have been all over the place.
Exactly.
But let's back up for just a second and talk about what does the Mosquito Control Division with Public Works, what do the men and women there do? And how do you organize that division? How does it all come together?
Well, you can kind of summarize what we do as an integrated mosquito management program, where we do sound science to back up the operations that we have. We do surveillance for mosquitoes, catch mosquitoes on a weekly basis in areas that we have scheduled. So there's a routine schedule every day of what we're catching. Those mosquitoes come back to the office. They get identified in the lab. We identify which ones are vectors for arboviral diseases. And then based on those populations that we get in our traps, we dish out operations that are necessary. Those that have more higher populations with more of a public health risk, we then concentrate our operations in those areas. And then afterwards, we're doing general inspections throughout the whole city of Suffolk.
And I think that's one thing people don't realize, the science behind what you're talking about. It's not just, well, we got a mosquito over here, let's go spray it. That's not how it works. And again, you're not really going after the mosquito itself per se, but the larvae. Correct? You're trying to get them early, so to speak, right?
If we can, yes.
Right.
When we have our technicians go out to the field to do general inspections on ditches, artificial containers, areas that are going to breed mosquitoes, habitats of stagnant water, those mosquitoes are identified there that it's positive for a larvae.
Correct.
You know.
Correct.
And our technicians will use larvicides, apply those as necessary to kill the mosquitoes as quickly as we can.
Got it.
in the larval form, we can take care of more mosquitoes than we can as adults.
I understand.
The way you kill adults is using adulticide from a truck, spraying from a truck, and it is much more broadcast.
Right.
So you're trying to hit a flying object,
right.
and a flying object as small as a mosquito with tiny droplets of what we call an ultra low volume adulticide.
Right. And certainly it is effective. It's not like you're not doing it for nothing, but at the same time, if you can catch them young, so to speak, it's the easier process.
It's more concentrated.
Exactly. Now, what is the typical lifespan of a mosquito? And I know that the different breed will provide variations probably to a certain degree, but what are we generally talking about a lifespan from, birth to the end of its life cycle without any kind of interaction with your department, so to speak?
It's interesting that you said breed, because mosquitoes aren't breeds like a dog.
Right.
They are their own species.
Okay.
So each mosquito species has its own different life cycle.
Got it.
That are sparked by different environmental factors. Some mosquitoes can live for maybe only 2 weeks. Some can overwinter and last for the year. Some can stay in different stages of their life cycle and live for 10 years.
Wow. Okay.
Now, the 10 years may be an exaggeration, but they do have different life cycles in which they live. So understanding the species biology and understanding when those mosquitoes are going to come out, using the surveillance that we have and our history of surveillance, we can see when our populations are coming out and when we need to focus on rural areas, urban areas, catch basin, drop inlets, and so these things are very important for us, and that is a part of the whole science of doing mosquito control.
Got it. Now, certainly, you and your staff do what you do, but there's a lot of things that the public can do to help the process along.
Absolutely.
And you mentioned earlier about areas that collect water, which is really the culprit. I think probably the primary thing you're talking about that people can do. But talk a little bit about just some basic things that people may not realize. And I guess it starts with taking an inventory of your property to see where these situations may crop up, and then following through. Correct?
Absolutely. People just on a weekly basis look at what's out in your yard. Things can collect in your yard. I mean, everybody has things that they do outside. They garden, and all these things have buckets outside. Artificial containers are going to be holding water. Those are the things that you need to tip or toss on a weekly basis. The things that you can throw away, please do.
Right.
If you can turn them over so they don't collect water, then that's going to be your best thing to tip and toss. That's called source reduction.
Right.
And that's the most simplest and most effective form, because if you don't have any stagnant water on your property, then you don't allow the mosquitoes to have a place to live, basically.
Right.
Other than that, we do provide mosquito dunks for citizens on a monthly basis. They can go to their local fire station. There's several other sites that we have mosquito dunks at, the libraries, and pretty sure City Hall.
Right here at City Hall, you can come to the Media and Community Relations Office to do that. They can go by your new facility out there on Carolina Road.
800 Carolina Road. And those mosquito dunks you place out in water. It'll treat 100 square feet if you have some stagnant water on your property.
Right.
And they have to be placed in water so that the larvae feed on that bacteria that's in that water, which is a very green style of larvicide.
Right.
It's basically a bacteria that is derived from the ground. So then you place that out in water and it just goes back into the earth. Okay.
So the myth that you just chuck it in your yard
is not something you do. You don't hang it, you don't chuck it in your yard.
Right.
You got to place it
Right.
in water so that
Exactly.
it's most effective.
There you go. And again, those are provided to residents of the city of Suffolk once a month. You go to one of the locations. I believe you just have to show a driver's license to provide proof that
Of residency.
Right. And then you sign a form, and then you're good to go, and you're out the door. And again, that's one of the things that the city offers
For free.
For free to encourage people to use these items.
Absolutely.
And what do they comes in packs of
Two.
Two. Right. Okay. Right. And again, what's the territory, the volume of water that one of those will serve?
Well, what we like
You
to
overdo
think
it?
of
Let me ask you that.
100 square feet, you can overdo it. It really depends. Larvicides and they have a lifespan, but we try to make sure that it's within the year that you can use it. So
Sure.
you do need to read the instructions on the back
Right.
so that you're reading the label and understanding what it can use. But typically, one donut, one dunk will treat 100 square feet.
Gotcha. Now, one other thing that your division offers, well, a multitude of things, on the website. You have a website, a great website. I know it's always constantly being updated and things, a lot of information there. But you have a unique thing that people can see where spraying is coming up in the city of Suffolk, so you kind of know where it's going to be near your area. Or I believe you also can put a request in.
Absolutely.
Right, and how is that process reviewed?
So you can go to the city's main website, and in one of the icons it has a mosquito control. You click the mosquito control button, and then that brings you up to our main page, and there's a big red button on our main page that says request a service or mosquito control services. You click that, and then it comes up with another page where on the left hand side you can submit a request.
Okay.
Yeah. And you put all your information in and try to be, somewhat detailed to see so we can know what we're coming up to when I send an inspector out or a technician out to inspect the property. If that's something that you want, or if you just want to do a spray request, that would be fine.
Now, if you say, for example, I know National Night Out is one of the events we have here in the city, and we coordinate with your division to make sure we get some of those areas where we have a high concentration of people there. But if you have an event, a big event like that, or you have a need for that, or you just have a problem, what's generally the turnaround? Because obviously you need to inspect before you act, correct?
So National Night Out is something is a special event,
Yes.
and you have a lot of people that are concentrated together. So those things that we do for the public and public parks are called barrier sprays.
Got it.
Barrier sprays are something that we schedule monthly, and they last a month.
Okay.
Citizens can't really request a barrier spray, but they can request an adulticide spray for the neighborhood, and that neighborhood will be sprayed within a week and a half.
And again, those are the trucks that come by usually at dusk. Do you do dawn spraying or just really dusk?
No, we have started to think about it because there are species of mosquitoes that are the highest population comes out in the morning. So.
Got it.
But we do usually spray in the evening, at dusk, and throughout the night.
Got it, because they're a little more active at those.
Absolutely. We do that because the mosquitoes are most active during that time, and non-target insects like bees and butterflies have basically arrested their activity for the night.
Got it. So, and again, when we talk about the time of day, that's also something to consider that in addition to checking out your yard or your area, certainly the work that you're doing, but also realizing when these things bite or when they're active. And, we talk about dusk, and I think people, you get home from work, well, I'm going to go out and do some gardening or something like that. You are putting yourself sort of in their domain at that point, correct? And then would the same apply in the morning? I know you said it depends on the species, right?
Yes, it does usually depend on the species. In the springtime, there's a lot more activity for certain species in the morning.
Right.
But if you are going to be outside and the weather's decent enough, if you can wear loose, long, and light-colored clothing, that would help you if you are really affected by mosquito bites.
Correct.
So that's kind of a thing that it's really difficult.
Right.
Well, mosquitoes like to be out when we like to be out. So what are you going to do? You want to
Right.
enjoy the summer. You want to enjoy when it's really nice outside.
Sure.
So.
Sure.
Yeah.
Okay. Well, Charles, I want to thank you and your staff. I do this all the time, but really the work that you do, sometimes, we don't hear you till we see the truck, and we don't think about you till we see the mosquito, so to speak. But again, if we don't see mosquitoes and we don't think about you, no offense, I guess that's a good thing, correct?
Yeah, sure.
And but again, thank you to everything y'all are doing to kind of keep the city of Suffolk as mosquito-free as possible.
Absolutely.
To continue to monitor things and check on it. And again, as we noted, a lot of science behind this. It's not just throw it out there and see what works. There's philosophies, a lot of training that goes on throughout the year. And again, appreciate everything that y'all do to keep us, as I said, as mosquito-free as possible.
Thanks, Tim.
Thank you, Charles. Appreciate it. That will do it for this edition of On the Scene. I'm your host, Tim Kelly. We'll see you next time.